The TraumaGuard procedure video is for demonstration purposes only. In a live procedure, ensure that local clinical policies are followed and implemented. TraumaGuard procedure preparation. Connect the TraumaGuard cable to the patient's bedside monitor. Zero the monitor to atmospheric pressure. The LED on the cable should be white. If red, follow steps A through B of the cable reset. Remove the TraumaGuard catheter from the sterile packaging. Fill the retention balloon with 10 cc of sterile water to test balloon functionality via the retention valve red. Drain the 10 cc of sterile water from the retention balloon via the retention valve red. Attach a drainage bag not included to the TraumaGuard port. TraumaGuard procedure insertion. Place the patient in supine position. Insert TraumaGuard as a usual Foley using an aseptic technique per local clinical policies. Secure the TraumaGuard catheter to the patient's thigh. Inflate the retention balloon with 10 cc of sterile water via the retention valve red. Retract the catheter until there's resistance. TraumaGuard procedure, cable connection. With the patient in supine position, connect the syringe with 5.5 cc of sterile water to the outer distal balloon valve, white. Pull the vacuum to evacuate excess air. Inflate the outer distal balloon with 5.5 cc of sterile water via the outer distal balloon valve, white. With the patient in supine position, insert the TraumaGuard cable into the TraumaGuard catheter by lining up the 2 pins on the cable to the 2 openings on the catheter. Insert until firmly in place, twist the locking mechanism clockwise until secure. The LED on the cable should be white. Remove 3 cc of sterile water from the outer distal balloon via the outer distal balloon valve, white. Disconnect the syringe. Monitor will display real-time unfiltered IAP and CBT. TraumaGuard procedure removal. To disconnect, twist the locking mechanism counterclockwise until free and gently separate to avoid damaging the pins. Attach an empty syringe to the outer distal balloon valve, white, and withdraw the volume of water instilled. Attach an empty syringe to the retention balloon valve, red, and withdraw the volume of water instilled. Gently retract, remove, and dispose of the TraumaGuard catheter per local clinical policies.